Hello, everybody. Welcome back to Transcending Humanity. This is episode 29 already. It's kind of hard to believe. I am joined today by a special guest, Dr. It's Abie, right? Dr. Abie
Maybe.
Mendelsohn. I
Like the
keep on.
alphabet.
Thank you. My brain no worky. I I have a 3.5-year-old, and he's just constantly sick, and sleep just doesn't happen. So,
Nope. Nope.
but Dr. Mendelsohn, could you introduce yourself and let us know who you are, let the listeners know who you are?
Perfect. Well, Vanessa, thank you so much for having me on. My name is Abie Mendelsohn, as you had mentioned. I have a number of potential titles. I am an otolaryngologist. I'm a head and neck surgeon. I'm a laryngologist. They all basically mean the same thing, which is I'm a doctor. I do subspecialty in ear, nose, and throat, but really, as a subspecialty, I've really just chosen to focus on the throat. All things related to throat, any type of disorders is kind of where I concentrate on. Certainly, I have a plenty of singers and vocalists. I treat, unfortunately, plenty of cancer patients as well that affects the throat. But what I've really been able to enjoy over the past, I would say, 4 to 6 years, as we've continued to increase the ability to provide important gender affirming care, is that aspect of my practice has really become such not only an important aspect just in terms of percentage, but really what it means to me emotionally and the rewarding aspect of that part of my practice. And so that's who I am. That's where I am.
Awesome. Um, I did a little teaser of this before we started recording, but this is actually very topical for me because pending insurance approval on December 5th,
Right.
I'm getting vocal feminization surgery and a trach
Oh,
shave.
congratulations. Oh my
So,
gosh. This is so exciting.
yeah, that's why I'm like,
Okay.
the timing of this couldn't be better.
Oh, wow. Okay.
But,
Fantastic.
so,
Congratulations.
thank you.
Obviously,
Unfortunately, it's not going to be
preemptive,
with
but
you, but
well, no, there are some really, really fantastic, and we all are learning from each other. And the fact of the matter is really when, I'm just saying in terms of my numbers are really being able to really collect a large group of our trans individuals who are getting the care that they need and deserve. Before that, it really was medical tourism. All of our patients had to go outside the United States and
yeah.
pay a hefty sum. And so when you look at kind of where all the experience is, it's really centered just in a few locations throughout the world. I would say for vocal feminization, for instance, South Korea. Obviously,
Really?
it's an incredible site, and really that's the technique that I use because the main surgeon over there, Dr. Kim, he has amassed like 500 vocal feminization surgeries. That's something that us in the States, I mean, maybe a select few can boast, but I certainly am not there. Hopefully we'll be there. Um, but now, again, to your point, Vanessa, it's just that you can find so many really reliably excellent centers throughout the country. And that is something that I think is just so many of the different reasons to celebrate what the kind of where we're going. We're not there yet, but I think there's a lot to celebrate of how we're moving along.
I mean, the very fact that insurance companies will even entertain it, I mean, I'm sure I'm going to have a fight, but they covered my
Yeah,
vaginoplasty 3 months ago, so I'm hoping they'll cover this.
I'm telling you, I had a patient legitimately, Vanessa, like 2 weeks ago, and they were scheduled for bottom surgery, orchiectomy, and we were hoping to do a combination that I can come in there and also do a trach shave at the same time. Obviously, one recovery. I mean, the benefits are obvious. We don't have to spell them out, but insurance said okay to the orchiectomy, but like refused the trach shave, and I'm just like logically it makes no sense. Like what is happening right now? Thankfully at the last second, literally 11th hour, and it's because so many of our trans patients are true warriors in the best sense. She got that reversed and got the care that she needed, and ultimately we're successful. But again, you just can't ever predict what they're going to say because I don't get it.
The best prediction you can give when it comes to insurance companies is for them to say no. Like,
Right.
they said no to my vaginoplasty, and it turns out it's because my surgeon's office just they just send over like the same like codes for everything, and the
Hmm.
orchiectomy was on there, and I had already had an orchiectomy done, so the insurance company threw it all out, and I'm like,
Right.
oh fuck.
Yeah. If
So
one thing's off, it's all gone.
and now it's
Instead of
happened
just saying,
again, but
I'm so sorry.
it's insurance companies are the absolute ruin of. I'm preaching to the choir here, but they're the absolute ruin of the medical profession.
Yes, but I think particularly for everybody who's tuning in, I think it's important to realize sometimes we can feel like the world's like stacked up against us and it's like coming right after us. Um, I include us because I feel I'm in battle. Listen, I'm a cis man, but I still feel like I can say us because we are all trying to achieve the goals, and it feels like it is stacked up against us. But it's having to do these fights with insurance for so many non-gender affirming causes. It's just how they operate. They just try to make our lives miserable, and so I think it's important for anybody either having undergone what we might say is close to emotional abuse sometimes by some of these last minute denials or worried about what might come. I think you give a great advice, which is just like have really low expectations so you don't have those, you don't fall down. But also understand that cis individuals also need to go through some of this sometimes.
Yeah.
So it's just it's a bad
Well, it's
system.
like the stupidest thing. You'll have it with medications too. Like, I have some toenail fungus right now, and my
Right.
insurance denied one of the creams. It's like, you spent $160,000 to give me a pussy, but you won't
Right.
spend $30 to give me a cream. I
Yeah.
I don't get it,
Yeah.
but
It's well, I think, and then as you can tell, we're going to go off topic a lot, but um, my main gripe, listen, insurance companies need to stay in business, right?
yeah.
They can't just pay for everything all the
No,
time
they have to
because,
make profit.
but here's what they don't do. They deny without providing an alternative solution.
Yeah.
So it's so easy to just say no, but for the cream, for example, they'll just tell you no without saying, but here are three other things that would be acceptable. And so the lack of direction, just leaving people afloat, which at some times in their lives is catastrophic.
It is.
And that is not an exaggeration at all.
It can be life and death.
Um, no question about it. Absolutely. They're just like, sorry, not my problem. And I'm like, it is your problem.
Yeah. I just don't think, call me crazy, I just don't think insurance companies should be able to allowed to override doctors. So,
Yeah.
because
Well, like I said, you can guide us. Like sometimes we're just like, we want the Rolls Royce of whatever. And they're like, well, we can't afford it, but you can take the Prius. And we're like,
yeah,
fine. But they'll just be like, no, you don't get to have anything. We're just like, that doesn't really work that way.
I know. I can't even remember the name of the doctor. He's a TikToker, but most of his videos are about his conversations with insurance companies, just like back and forth. They're funny as hell. It's
Yeah.
better when you're watching it and you have some idea who it is, but
All right.
yeah.
Right.
But
That's hilarious.
sorry, my dog is probably going to be making noise cameos because the listeners are used to it. She's
Perfect.
jealous of the other dog who's upstairs,
Oh, sure. For sure.
and whatever. But yeah, it's my advice as someone who's been navigating the entire insurance thing. I used the Affordable Care Act, and
Right.
I signed
Yeah.
on with Oscar Insurance, which is the Cleveland Clinic's
Yeah.
insurance, which is where I'm getting everything
Yeah.
done. But
Perfect.
it's just stick with it, and your doctors
Yeah.
will fight with you. So, like when I had problems, my doctor's like, "Oh hell no," and
Yeah.
they fix things. So,
Yeah. I think wonderful advice. And I'd also say the doctor's office who are unwilling to fight and maybe are not in it for like the entire correct reasons. Obviously there are people who are just like, oh, take those wackos out of my office. I don't want anything. Obviously there's a lot to say, like, to offer gender affirming care. I think that needs to celebrate it and we need to appreciate. But we need to be in this fight because the more we do, the better.
Hmm.
And specifically, Vanessa, to your example about Oscar, I think a lot of people, particularly when deciding with insurance companies, specifically toward transgender care, feel this need to go to the top line, like the Blue Shields or Cignas or Aetnas. Actually, in California, I gotta be honest with you, we have a lot easier time with Affordable Care Acts and Medi-Cal groups, a lot easier time achieving gender affirming care than the
Really?
quote unquote good insurance. Oh yeah. So um, you know, you know, that's not necessarily a reason to feel like, oh, I'm gonna get the best insurance and then I'll get the best care. When we think
Yeah.
about gender affirming care, that doesn't always match up. So it does take a little research.
And well, yeah, and it's different state by state. I live in Ohio,
Right.
and
Yep.
even though insurance carriers aren't technically allowed to discriminate against trans people, they do because they can afford to get away with it.
Right. You just make your
So
life so miserable
yeah,
that you're just not going to get the care that you need.
yeah. So you have to
Yeah.
do tons of research in advance, and
Mhm.
Oscar honestly was the only one that would cover my vaginoplasty. So that's why I went with him.
Yeah.
It's expensive, you
Yeah.
know. I'm spending 200. I only make $20,000 a year, and I'm spending $200 a month on insurance,
Right.
but
Yeah.
it's what you have to do. So, and yeah, it's do your research, do it very
Yes.
carefully, and talk to
Yes.
anyone that might know what they're talking about because
Mhm.
it's hard, but
It is.
the rewards are, well, sitting right there. So, someone that can
Yeah.
fix your issues.
Absolutely.
I can't wait for mine. I've done a lot of vocal training,
Yeah.
and
Well, I'm listening to your voice. I think you're doing so many wonderful things, and importantly, so many things that we cannot address
yeah,
from a surgical, vocal feminization surgical standpoint. In
hmm,
other words, we can't just magically wave our surgical magic wand and just create a feminine voice.
no,
We can adjust pitch, we can do things to the vocal cords,
hmm,
but there are so many things. And sometimes when our patients don't fully grasp that and they think, oh, just tweak my pitch, and then all of a sudden I'm going to go man, woman, it's like it doesn't really work that way.
no, not at
And I
all.
love what you're doing. You have a softness to your voice. You're speaking up in your face and really into
Hmm.
the nose. Your cadence, so many things that you're doing vocally just screams woman to me. This is so it's fantastic.
Thank you. I appreciate
Yeah.
that, especially coming from you, someone that knows what they're talking about. Yeah, it's because the surgery it changes your pitch, and for me, I start falling down later, long throughout the
Yep.
day, and it starts going like this, and I start talking out of my throat a little bit.
Right.
Luckily, I don't go all the way down to my dead voice like
Right.
this, but oh, I hate that sound so much. Um, so, but yeah, it's the surgery is it fixes pitch, but you still need to do training.
Oh yeah, no
But
question about it.
a lot of offices offer training as well. I my
Yeah.
surgeon's office, I found out about the surgeon through my vocal
Perfect.
training, who's in
Yeah.
the same office. So
That's so great.
okay, well, I have a few questions. If you would like to do a quick little
Oh yeah. No,
interview.
I mean I feel like we can just chit chat for like 3 hours and just
Yeah,
like totally
yeah,
over.
that's just kind of how I work with this podcast. But
Perfect. Yeah, but
this way,
let's
I
go through
can.
some questions. It's great. Yeah,
Yeah.
guide me. Otherwise, we'll get lost.
Well, I'll start off with how did you get into the field of all this of working in ENT and I don't even know I can't remember the correct words for it.
Yeah, it's so long. It's
Orotonology.
almost yeah. It's otolaryngology, which is actually a misnomer because it stands for oto is for ears,
Hmm.
and larynx is the throat. So otolaryngology. But we're missing because ENT, so it's actually otorhinolaryngology.
That makes more sense.
But that just yeah, exactly. But that for some reason thought that that was too long, so we just went for the otolaryngology.
Hmm.
But I don't come from a medical family.
Oh.
I had no idea what hospital rounds were. I got most of my expectations of what med school was going to be like from watching ER and George Clooney, and seeing Dr. Carter go from medical student to attending physician, and that was really kind of how I was figuring out what to do with my life. And it was actually quite by accident that I found this rotation, this otolaryngology ENT.
Yeah.
It wasn't even on my sites. But what happened was I kind of fell in love with surgery.
Hmm.
go into the operating room, getting in there with my hands, fixing a clear and obvious problems. Obviously, it doesn't always fix everything, but you're accomplishing a singular goal with that surgery, and you work hard, then you go home,
Hmm.
and then you come back and do it again. And what I loved about what I do, head and neck specifically, was it was such a tightly packed mess of anatomy, the nerves and blood vessels, and all this complexity, which I figured I can spend the rest of my life just studying and getting better, and really never achieving that goal. And that's something beautiful because we just want to continue to grow through our lives with whatever we're doing.
Hmm.
And then once I was like, okay, I remember coming home to my wife and telling her, that's it. I know I'm going to do it the rest of my life. And that was an exciting moment because, it only took me into my 30s, but at least I got there.
Yeah,
Um,
yeah, that's not bad.
uh,
I'm 42. I don't know what
but
the fuck I'm doing in my life,
exactly,
so
just what am I going to do when I grow up?
yeah.
Um, then once I started getting more experience within this field, really the throat, really the voice box in and of itself
Hmm.
for me was the most magical area. And the reason is because A, we have no concept of how it all works. So when we think about the mystery and being able to really study and continue to increase our knowledge, the voice box is really kind of where it's at. As well as it's really what makes us human.
Hmm.
Obviously the brain keeps us alive, and we need a heart. The liver is very important. I'm not going to say who's more and less important. The lungs, I mean, come on, how are you gonna, you got to breathe. But when we talk about humanity, what do? We communicate, we sing, we talk, we eat, we breathe. These are all
Yeah.
the activities that the voice box controls.
Hmm.
And I thought that that's really kind of defines us as who we are as people. And I thought, what could be more beautiful if I can help people either preserve those functions or regain them after they go through something horrific. And so for
Yeah.
me, it was just I knew this was what I wanted to do.
It's magical, really.
Yeah,
So, and as
yeah.
you said, it's such a complex area that
Oh
it's like a puzzle. It's a challenge. It keeps things interesting. I imagine
yeah.
it's like playing
Oh yeah.
Operation, I guess.
It legitimately is,
Who'd have thought?
it's when we have trainees or students, I make that joke sometimes. I'm like, oh, just pretend like you're playing the game of Operation.
Hmm.
Unfortunately, I've dated myself a little bit because not everybody knows about like actual physical board games anymore, but
I know. It's weird. I,
it's so crazy.
I'm raising I'm an Xennial raising a Gen Alpha, and
Right.
like the kids they have in his daycare, they have like office phones that kids are like, what is this? It's
Yeah.
like,
What is antique? This is
yeah, it
fantastic.
has a cord on it. Is it a jump rope or what? Uh, I feel
Oh
old
boy.
now.
Yeah, I'm sorry.
So how did you get into the whole trans healthcare thing? How did you
Right.
kind of jump into this whole part of the community?
Right. I think it was, my kids, speaking of kids, we can brag about our kids. My kids always laugh. We all have like the quotable lines that we're
Hmm.
doing. And I always talk about like my career path professionally is just one big happy accident, just kind of falling into the right place. Like I fell into ENT and then I fell into, throat specialist called laryngology. It's just kind of like just around, and I'm always willing to help and say yes when I can. But after I was done with my training, what's called residency at UCLA, made the decision to actually go out to Belgium for some advanced
Really?
training. Yeah, it was wild. The whole story behind that would take a whole hour. But anyway, I found myself in Belgium, learning laser treatments, and they were just ahead of the curve on so many different aspects in terms of surgical care, really minimally invasive. Talk about
Which is big.
preservation, particularly after care. Oh, it's again, it's critical. It's
Hmm.
why are we doing it? Why would you want to be cured of cancer if you can never speak or eat or do anything
Yeah.
again? It's like kind of like, well, what's the point really then?
Hmm.
So I was really excited to go out there. And in addition to being advanced in many ways from a technical standpoint, certainly from, I would say, a progressive and societal standpoint, Europe was also light years ahead. And so my first really true experience with transgender care, specifically with vocal affirming care, um, was in Belgium, and it
Hmm.
was just it was a dream. It was like what we always want. We want to find a way to truly be able to manipulate the vocal cords so that we can achieve this wonderful goal. Like it's
Mm-hmm.
not just for fun, it's not experimenting. And it was just like, oh my God, this is possible.
Mm-hmm.
And for me, that was just incredible. I came back from my training, came back to Los Angeles. Got on faculty at UCLA, and I was like, okay, I'm ready. And then obviously the problem is, it's not like we have like a ton of trans individuals with bags of and briefcases of cash
Yeah,
laying
we
around.
don't
So
have
just kind of
money.
no. I have a lot of people like, oh, how can I get into this? I'm like, well, you can believe that you're helping someone, and
Mm-hmm.
if you get paid, that's nice, and if you just do your best. But um, yeah, this is not, shall we say, the Beverly Hills cosmetic practice that we see.
Mm-mm.
This is truly, a labor of love. So it kind of just fell dormant just because the opportunities weren't there. And then all of a sudden, again, I would say about 6 years ago, it really started all of a sudden just kind of creeping up. Someone's like, "Oh, would you be willing to see someone who wanted, you know, either a trach shave or vocal affirming?" I don't remember exactly where it all started, but
Mm-hmm.
um, I was like, "Yeah, of course, yeah, this is amazing." And it was just one by one, and then all of a sudden, people are like, "Oh, who's doing that?" And then all of a sudden, next thing I know, it's 200 patients later, 250 patients. It's like, what?
Damn.
Um, it's just great. It's just been this, self-affirming cycle, which is the more I get to do, the more people I get to meet, the more I get to learn about this, the
Mm-hmm.
better I get. It's just been almost an obvious outcome where it's like, of course, you can't help but get more involved.
Yeah.
Yeah.
And oh, I'm so happy that there are doctors like you out there. And it's because, well, a lot of doctors don't seem to have much care about any training on how I'm working with trans people and stuff like that.
Right.
So, like, I talked to someone like you or Cecile Ferrando,
Hmm.
who's my surgeon for my vaginoplasty, true allies to the community
Yeah.
that are interested in us and are cheering us on. I mean, what you're doing, whether you realize it or not, you probably have saved a life or two just from
Oh,
doing the
no
vocal
question about it.
feminization. So,
Yeah. Yeah. A lot of times I'll either have a chance to speak to someone in the hospital who's either ignorant or hateful or maybe a
mhm.
little bit both. And they really, to give them as much credit as I can, they're really like downright confused. Like, why would you want to do this? This is like, why would you get involved here? And to your point exactly, it's a very simple process. I said, I save lives.
Mhm.
I save lives. I help cancer patients, and when I get to perform a gender affirming surgery or just having a gender affirming therapy conversation, I save a life.
Yeah.
And I know for a fact that I have,
Oh
like,
yeah.
not like, oh, it probably,
No, you have. You have.
obviously I will not tell you the persons, but I know for a fact that I have, and it's still fantastic.
Do you have any like memorable experiences or success stories from patients that you'd like to share? Anything like
Yeah, yeah.
stands out?
There is there've been a few transformative
I
um
see what you did there.
um I actually didn't, but I'm glad I did. It's almost like it was meant to be.
Right?
Um, when we do the post-op visits, there've been a couple times where just we all just kind of like, what? Either it's vocally and or trach shave, where it's just
Mm-hmm.
like, what just happened? So from that actually happens more often than not, which is again one of the things like I just need to do this more and more.
Mm-hmm.
I would say there's really two stories that stand out for me. One is a story that I tell often, which is as we're getting one of our patients ready for her vocal feminization surgery. Once anesthesia, the next step is to make sure everything's padded and secured, get the pads under the elbows so there's no sores. As we were moving the arms, I saw along the wrists pretty deep slash marks, which were obviously not accidental.
Mm-hmm.
And it was just to our point before, it was just so reassuring that we are doing so much good in this world.
Mm-hmm.
And it was just it was crushing because understanding the pain that was involved to create those scars.
Yeah.
But also knowing that potentially we were providing this safety blanket that can hopefully be just something about their past. Another just wonderful, beautiful story. We just like yourself, and so we were able to do combined vocal feminization and trachea on a patient from out of state.
Hmm.
And she called about 6 weeks later, and she said, "I just wanted to call and just share with you a story." And I said, "Great, I'd love to hear it."
Yeah.
She said, "I just wanted to let you know that I went to the gym yesterday, and she went into the locker room, and she said it was about 15 minutes before she forgot that she should be nervous." And it was so striking because for her, she shared with me that by far, going to the gym and going to the locker room was the worst experience of her weekly routine by far.
Yeah.
And again, most of us cis individuals just don't understand it. Nobody likes the locker room, but it's not downright just panic stricken when you have to do that.
Yeah.
So A, we don't understand. But B, it was such a beautiful um, journey that not only was she so secure in now her gender, but the fact that she didn't even remember that it was supposed to be anxiety provoking. I was like, and I was
That's
like,
huge.
did it? Yeah.
I can relate with that. Like that's one of the reasons I'm getting this done is because if I go into a ladies' room, like what if I slip with my training and all of a sudden I'm talking like
Right.
this or something like that, and
Yeah.
people are like, who is this guy in the bathroom? I'm like, well, this guy's a
Right.
pussy. I need this. I need to pee here. But
Right.
yeah, it's that's a worry, and
Yeah.
especially since I'm running for office, and
There you go.
just to help with the whole because I'm one of two trans women in Ohio running for office right now, but
Wonderful.
it's giving speeches and stuff like that. I my vocal modification I tire out very easily, and with the pitch. So just
Absolutely.
being able to
Absolutely.
keep the pitch up is going to help a lot because I'm already fighting an uphill battle in a very conservative area.
No question about it.
So
No
it's kind of
question.
it's a safety thing. So there's so
Yeah,
many
you're
things
exhausted.
involved.
Let's say you're doing three different events back to back and you're doing nothing but talking and shaking hands.
Yeah.
I have plenty of patients coming in for consideration for vocal fem surgery, who I walk in and I legitimately have no idea why they're there. I'm like, "Hi, what's your
Hmm.
name? Nice to meet you." And they start talking. I'm like, "I have no idea why you're here." And exactly to your point, either it's just from mental exhaustion, physical exhaustion. The vocal cords just cannot continue in such effort.
Yeah.
Um, and then they'll also say early in the morning, when you first wake up and roll over, whoever's in bed with you, maybe that's a safe spot, maybe that's not. Late at night,
Yeah.
and then after a few drinks.
Hmm.
So it's just like, to your point, you want to go to the restroom. Maybe you're having a cocktail or six or seven. Now you have to go to the bathroom after so many drinks.
Hmm.
And now you're just like, I don't like, am I allowed to talk? Can I talk? That's just,
Yeah. You
those
become
are,
terrified.
those are thought processes again that I never have to deal with.
Hmm.
Like, I had a few beers. I'm allowed to go to the bathroom.
Yeah.
That's actually quite normal.
Yeah.
So again, it's one of those things where I'm continuing to learn and understand like what I think is very straightforward is anything but.
Another thing that kind of factors into it too is a lot of autism and being transgender. There's a pretty heavy overlap between the two. I'm autistic
Mhm.
myself. A lot of my trans friends are autistic as well. It's become kind of a meme, and but when we're having an episode, it becomes really hard to maintain a voice as well. So
Right. Oh yeah.
that's I I have a friend that she does amazing. Her vocal training is amazing. Her name's River. She's on a
Hmm.
podcast called Trans Spotting, and like when I first heard it, I reached out to them because I'm like reached out to her because where did you learn to do that? and it's just how she just does it. It's just amazing.
Right.
But she falls into those times too where gets tired and this, that, and the other, and it starts dropping down a little bit more. So
Yeah.
it's it's a thing.
No question.
So a little bit of a trigger warning to listeners and viewers here. Just so you know, you are being recorded for film too. I hope that's okay.
Yeah.
This goes on YouTube. Okay.
Woo.
And I'm good. A little trigger warning. We're going to be talking about the surgery kind of stuff here.
Yeah. Good.
So, you, for the trans community, you're mainly doing the vocal feminization surgery, which, from what I understand, it's an endoscopic surgery.
Yes.
And so you have your vocal cords are like this, and you put a band. Is that the way that you do it? You put the band here between that kind of like pulls it up a little bit more like a Y.
Exactly.
Okay.
Exactly. Almost like a V to a Y.
Mm-hmm.
And that's actually a pretty common medical term in plastic surgery where they try to do scar revisions. They'll actually make a V shape and they'll turn it into a Y shape.
Mm-hmm.
You can think about bringing that apex down. There have been a number of different approaches and techniques described to achieve this goal, which is a natural sounding voice, which is elevated within at least the androgynous zone, but again, ideally within to what would be societally recognized as feminine. The technique, I only offer one technique because in my hands and my understanding of the literature, there's one technique that really not only has the capacity to provide things like ability to sing afterwards, whether it's in a shower or on stage, it doesn't matter. They're both very, very important,
Mm-hmm.
but also has long term, meaning not reversible naturally.
Yeah.
It's not just something that's going to pull apart. And so that's the technique that has been described out of South Korea, out of the Yusan Voice Clinic. Yusan, by the way, Yeson, has a fantastic website. They got a great Instagram page. They do a much better job, and I mean much better job than I do in terms of getting the pre and post recordings. But again, what he had described, his glottoplasty, there's a very long name. It's vocal fold shortening and anterior commissure retro displacement, which is just a mouthful.
Mm-hmm.
I've had to practice that a few times. His surgery, basically, from an analogy standpoint, attempts to put a capo on the vocal cords, and a capo is that clip on the end of the guitar, which makes
Mm-hmm.
all the guitar sounds a little bit higher. And
Yeah.
that's exactly what we tried to do. It effectively shortens the vibrations of the vocal cords.
Mm-hmm.
And by doing so, increases the standing or the comfortable pitch. That's done through the mouth, like you're saying,
Mm-hmm.
under general anesthesia. So when a person is sleeping, we're able to go directly through the mouth, bring in the microscope, look at those vocal cords, take off the very cover of the front part. We usually are estimating about 30 to 40% of the front, if you think about front to back, the length of a vocal cord,
Mm-hmm.
and then through the mouth, which is it's a specialized technique, but
Yeah.
with a little bit of practice, we're able to put a stitch down there and then
Mm-hmm.
put a second stitch to really try to taper up the vocal cords, and then we come on out, we're all done. Overall, that surgery takes about 45 minutes. So it's a really nice, straightforward, overall, very limited amount of discomfort, a
Mm-hmm.
little bit of sore throat for a couple of days, but particularly as you're describing, with the gamut of gender affirming care, specifically from a feminizing
It's not a
standpoint,
big deal.
this would be one of the more exactly more mild interventions. However, I've had several patients tell me who have gone through several different surgeries, top, bottom, and face, everything. Um, um, they said emotionally, their vocal fold surgery was the most impactful surgery for them in
Really.
terms of their own adjustment.
Mm-hmm.
I was trying to understand. I didn't really fully understand why that should be so. But again, I think that they just saw, again, their own voice, what they're ready to listen to is who
Yeah.
they are. And whether it was a top surgery, that never defined who they are. In fact, quite the opposite. That was they were able to kind of slide into exactly where they're supposed to be.
Yeah.
Um, and for whatever reason, they felt like that adjustment after the vocal surgery was more jarring. Not
Hmm.
to say they were not happy, but it was, again, while it might be not as impactful physically in terms of the recovery, we don't discount again what that emotional journey will be.
Yeah. And excuse me, the with the voice saying, like, for the other things of the body, like getting top surgery, bottom surgery, whatever, as I smack my mic, um, it's when you talk, you're noticing that a whole lot more. Like the the changes with your body, it's more like, well, me, I look down, I have tits, but
Right.
like the other things, like you don't notice as much, but your voice, you hear it all the time, and you quite literally hear it in your head,
Right.
and just being able to just talk and have the voice that matches who you are come out of your mouth is a huge fucking thing.
Oh yeah.
So it's,
Oh yeah.
I kind of like to think what you're doing is you're tuning an organic guitar almost. So
Yeah.
it's like a,
That's
a
precisely.
string reed instrument that you're
Yep.
tuning. So
That's exactly right.
it's pretty
And it's
cool.
wild. Oh,
Yeah.
I love it. It is so cool. It's yeah, yeah. It's hard not to get excited about these kind of things.
Yeah, no kidding.
It's just, and what also is cool is a lot of times when we're doing these vocal surgeries, everybody in the operating room, particularly people who may have zero experience with any type of joint infirmary care, or even those who have been kind of on the front lines and they've never seen this one, they're like, "Wow, that one really is that's something new." Yeah,
How often, like, I know for 2 weeks after surgery, you can't talk. And
right.
that's going to be interesting for me as a parent. I actually already, I put an app on my phone where I can type in phrases and let my
Right.
phone tell to my kid. But
Exactly. Yeah, that's a good one.
what, like,
You can buy some tennis balls and Sharpie them and throw them.
there you go. Oh, great. Just what he needs. More things to throw back at me. Toddlers are
Yeah.
dictators. The kids even started goose stepping lately. I'm like, come on, dude, stop it. Um, but
They know how to push the buttons.
yeah, they
Yeah.
do. So it's a permanent surgery.
Correct.
How often do things fail?
A great question. Um, Obviously, it depends on what you mean by fail.
Hmm.
When I hear that question, the way I understand that is catastrophic injury to the vocal cords,
Hmm.
meaning not only do we not achieve our goals for gender affirming care, we've actually destroyed the vocal quality altogether.
Hmm.
And and I've seen patients come out of surgeries with horribly scarred vocal cords, where they sound like 90-year-old smokers,
Hmm.
and it is not pleasant to listen to. And again, we don't, we move away from gender affirming care and just salvage any type of what we consider like a clear sounding voice.
Yeah.
That is a failure.
Hmm.
Thankfully, that's never happened to me. But I think you do surgeries long enough and really bad stuff may end up happening.
There's always a risk.
Um, yeah, always a risk. I think that may happen for two potential causes. One is a surgeon who may not be overwhelmingly familiar with the techniques and kind of how to make sure to keep the remaining vocal cords safe.
Hmm.
Obviously, it's important, but even in the best and most experienced surgeons have bad things happen. What I mean by bad things is I had one patient, and this was earlier on in my recent experience. She suffered, I think, one of the worst sinus infections that I've ever seen, like within 3 days after the surgery. And she was just pouring down the equivalent of acid, which was just this thick mucus down
Hmm.
onto the vocal cords. And when by the time I got to see her, which was like, I don't know, I think it was like 4 or 5 days later, her vocal cords were all just so beefy red. I was terrified, absolutely terrified that the worst, that failure had happened. So sometimes it's just dumb bad luck,
Hmm.
for whatever reasons, and usually it's from an illness
Hmm.
that happens very quickly after surgery. Um, we were able to save that person's voice. And the reason why we were able to save it, basically what I did was something I do now all the time, which is I injected her vocal cords with Botox.
Really?
Yeah,
Huh.
everybody gets Botox. So now everybody gets Botox. And what Botox does for our foreheads is it weakens the muscles so that they can't crinkle together and cause those lines that
Hmm.
may not be the most attractive. But so we were looking to weaken the vocal cord muscles so that they can't cough too strongly. They can't overdo it during the healing phase. And fortunate for Beverly Hills plastic surgeons, Botox wears off, so they have repeat customers. So for
That's
us,
true.
it's perfect. It allows the 2 to 3 months of a healing time to kind of ramp back up. And so earlier on, I was holding it back in terms of just uh, crazy situations like that sinus infection.
Hmm.
I just I just went crazy with the Botox. I'm like, we're just shutting your vocal cords down and we're going to hope that they heal. And they did. Obviously, we also treated the sinus infection.
Yeah.
Um, but now, every single one of my vocal fold surgery patients, before we're ready to wake up, you get a shot of Botox into each vocal cord, and then we wake up. And so that just really helps that time period after those 2 weeks, or even I say within those 2 weeks. The best story, and my patients will tell you, I say this story all the time. Like, what happens? You're watching an old lady cross the street and the bus is about to come. You can't help but yell,
Hmm.
like, and stop, don't walk. But you're on voice rest. Hopefully, your body reaction just takes over. And so, what the Botox does is just prevents you from unwittingly putting too much pressure on those stitches, even within those 2 weeks, just in case.
I'll have to ask my surgeon if he does that. It's interesting.
Yeah,
So
yeah.
I'll probably send this episode to him. Be like, here, give me some Botox, Butch.
Yeah, exactly. Come on.
And now it sounds like it's a failsafe. So I
It
mean,
really is. It just allows, when we talk about vocal feminization surgery being more of a safety net for so many of our patients who are
yeah,
actually able to achieve a passing voice for the most part.
yeah.
I would say the Botox does the same thing. In other words, I even do it for compliant patients. I know they're going to do exactly what I asked them to do, and they're really good, and they've done their vocal training, and they're planning to go back. They even get the Botox. For sure, people are, I'm like, I don't know.
Hey, that's so awesome. So next, I want to cover before we run out of time the tracheal shave, which is the other
Yes.
part of it. For listeners and viewers, tracheal shave is people with Adam's apples, which cis women get Adam's apples too. It's
Oh, yeah.
but like mine, I have too much neck fat right here, so you can't even see my Adam's apple. But I know I have one because my senior photo, when I weighed like 80 pounds less than I do now, I have it there. So I asked, I'm like, if I can get my insurance to approve these surgeries, I'm just gonna have them do both at once because you're already in that area, already getting stuff healing
Totally.
there. So
Yeah.
that is going to be that one. You have a special technique for that, am I right? Where well, he's getting all sly and happy,
I'm getting giggly now
getting
because this
giggly.
is this is something that I just uh well, the reason is because it's been about 4 hours since I did my last one. So yeah, so it's just something I'm just so excited about, and I am very
Spill,
hopeful
spill.
that eventually it's going to be. So the traditional surgery for tracheal shave is, again, to reduce that Adam's apple. There's really no part of the body outside of genitalia that is so gender dominant
Hmm.
than the Adam's apple.
Yeah.
To your point, there are plenty of starlets on the red carpet that have very visible voice boxes. You can kind of see every crease and crevice
Hmm.
in their neck. But importantly, while you're able to see, oh, there's a piece of cartilage there, none of those bumps are really much more dominant than the rest. There's
Yeah.
been some scientific studies. 3 millimeters is like kind of the threshold. Once you go above 3 millimeters outside of the neck, more than the other contours, that's considered masculine. But obviously, the outside experience of someone is very small
Yeah.
part of what's going on. I think, to your point, I've had many patients who had tracheal shave that externally, I'll never be able to see that excuse me, that Adam's apple.
Hmm.
And I abhor this concept where surgeons will say, "Oh, you don't need it," because it's not for me to say whether someone needs it or doesn't need it.
Yeah,
I've had plenty of patients who say, "I just know it's there and it's not part of me," and
exactly.
that's all it is. And it's a very simple process.
Hmm.
So this idea, again, back to our early conversation with Vanessa, is like insurance company want pictures. I'm like, pictures? What are you talking about? What? What? Who's giving the stamp of approval? Anyway, as you can see, I can go off on that. But the point is that the Adam's apple is wholly masculine. It needs to come off. And the good news, the Adam's apple itself, that extra cartilage, does really nothing
Hmm.
for us. It provides no purpose. So we can get rid of that pretty quickly. Now, we do need to be careful because just below the Adam's apple is where the vocal cords are attaching on the inside. And so if someone's fully concentrating on the aesthetics of how a neck looks and not remembering so much that the vocal cords on the inside, then we can get that other type of catastrophic injury. Again, losing the voice because that the vocal cords have been sheared off literally.
No. Ooh.
And
No.
so, yeah. So again, looking for someone with experience, understanding
Hmm.
how to keep those vocal cords safe is pretty critical. But again, traditionally, what the surgeries were described is you would either make a cut along the Adam's apple. I'm very fortunate I have a really nice example I can
There you
model for all
go.
my
Yeah.
patients. Yeah, there you go. You know, this is like thankfully, I'm like I don't even have to go to the anatomy books. I got it right here. Either make a cut directly along where the Adam's apple is, or some surgeons will go just a little higher underneath that crease under the jaw. Go down, find that, take down the extra cartilage, come out, stitch it up really nice. I've always been somewhat conflicted about that surgery because I feel as the surgeon I'm making a person choose between living a life with the Adam's apple versus the potential of a scar. And
Hmm.
sometimes scarring is not too bad. Sometimes scarring is horrific, always catches the eye.
Depends on the
And
person.
well, yeah, and you don't know until it's too late.
Hmm.
It's really hard. And some people are like, oh, I healed very well, and I've seen that, and then they don't heal well next time. Is a million different factors. So
Yeah.
it's a roll of the dice. Um, and so I always felt somewhat not guilty, but like, am I really doing the best I can?
Hmm.
So we sought out really about 4 years ago to change this whole paradigm. It's saying, can we do a tracheal shave without any cuts on the skin? And thankfully, now about 185 patients later, I can very much say that we have done so. What we do for our tracheal shaves is make a cut on the inside of the lower lip. So we hold that out and then go along the cut on right in front of the bottom teeth, a soft spot. Go underneath the chin, and with the camera called an endoscope. We use the camera to get down there under the surface, and we can get down to the cartilage. I have this long pincer, looks like a maybe like a toenail clipper, a
Hmm.
little burr to curve down any contour and make sure there's no sharp edges. Come on out, put some absorbable stitches on the inside of that lower lip, and and I would say good as new, but it's even better than new.
Yeah.
It's been really exciting. The first several patients, obviously, there was a large discussion. Hey, we're trying to do this, and a lot of patients came along that journey with us. At this point, we got the technique and the instruments down
Hmm.
to really something that it's quite rote. And I'm hopeful that this is not just something unique that one person is doing. I really hope that eventually, as we continue to show that gender affirming care is just healthcare.
Hmm.
It,
It
it,
is.
it doesn't
It is.
require,
Very.
it's just healthcare. It's
Hmm.
just there's someone who I can help. I want to help that person.
Hmm.
That's what we do. A doctor, a nurse, we all do the same thing, which is we find people that we have skills to help and
Hmm.
we need to help that person.
Hmm.
That's it. It's as simple as that. I'm hoping as we continue to see that, I would say, acceptance and participation, that really tracheal shave is something that never cuts the skin because someone shouldn't have to worried that a scar where the Adam's apple used to be could be just as outing
Yeah.
as the Adam's apple
I
itself.
mean, I'm gonna have that scar because
Right,
I know my surgeon does it this way because
right.
I
It's
follow another
standard.
trans girl that had it done.
Right.
So,
Yeah.
but that's what you're describing. That's like pure art. Is what you created a new art form. So, that's
I know
really
it's so
badass.
cool.
Yeah,
I got to be honest with you. Like a lot of times I'm like, oh, it's no big deal. I'm like, no, this one's a
this
big
is a
deal.
big
Like
deal.
I love what we do.
Mm-hmm.
It's again back to like getting a chance to have like a new circulating nurse in the operating room, a new anesthesiologist who literally has no idea what they're about to walk into, and
Yeah,
they're just like, I'm like, you're gonna see something really cool today.
that is just that is so cool.
Yeah,
That
I
I know
love it.
that was one of the things that I know it's like your pièce de resistance or however.
Yeah,
So, but
yeah. It's what I feel like I can actually say like I contributed something.
yeah, definitely. And boy, I hope that
Yeah.
spreads.
Yes,
Do you go to like
exactly.
conventions and stuff and talk about that or?
Yeah, absolutely. Yeah, we've been presenting we've been a few publications, I think like three different publications in the
Mhm.
medical journals. Right now writing a textbook with my amazing friend Dr. Justine Lee, who is like an incredible facial femme surgeon at
Mhm.
UCLA. She is like the coolest person ever. So she's writing a textbook and gonna get that chapter in there. So again, just making it hopefully just standard part of gender affirming care.
Yeah, that's
Yeah.
amazing. This is
Love
oh,
it.
this is so fun. I really hope that people watching and listening to this show really find this informative because just finding information on any sort of gender affirming care overall, most of the times people just have to go to Reddit and just hear it from other people.
Yeah.
So it's very rare to have. I know my vaginoplasty surgeon also wants to be on the show because it's very rare to have
Yeah.
a doctor on here that can just have a conversation and say this is what this is and get answering questions that way and it's educational. So I hope that people find this episode extremely helpful. And yeah, I mean, thank you so much for joining me. Do you have any final thoughts or anything that you want to just kind of spew out there at us?
Yes. I first of all want to say thank you, Vanessa, for inviting me on your show,
Thank you.
allowing me to have the platform to you and your audience. I just enjoyed myself
Me
tremendously.
too. This has been great.
I wish you continued success on not only your podcasting activities, but in your social services and hopefully attaining offices and continue
Hope
to
so.
contribute. You are doing some fantastic things, and I wish you all the success.
Thank you.
Yeah. From a parting words, I would just say. Um, um, it's very important that anybody who is even within the realm of transitioning, certainly transitioning and then beyond, or having transitioned, but even well before that, understand that there's so much, so confusing, it's so overwhelming. There's so much mystery and even worse, anxiety, and even worse than that, true hate and violence out there. Please understand you're not alone. Please understand that just because you come and meet with a surgeon does not mean you're getting surgery. It just means you're collecting information.
Hmm.
There are so many times when someone comes in, we have a very long conversation and they say, "Thank you so much. I'll call you if I need you." And I say, "Fantastic."
Hmm.
That is not a waste of my time. I
Yeah.
feel really privileged to have been able to contribute in some way. It's not like if you don't want surgery, get out of my office.
Yeah.
It's really something that there's so much out there. Unfortunately, it does take a little bit of effort, takes a little bit of investigation,
Hmm.
speak to people, hopefully face to face, as you're mentioning, Vanessa. I think there's so much misinformation
Yeah.
just on general searches, even within Reddit. Um, so hopefully speak to actual people, understand you're not alone. And there's some good information out there just to let you know that there can be a plan in place. And even if that plan is, hey, we'll check in with you again in a year from now or
Hmm.
whatever you need. Or let's get out to your insurance company and get you all
Let's
these
do
things
it.
that you actually do need,
Yeah.
whatever it is. Stay away from people who have a preset agenda. Oh no,
Mm-hmm.
you need to do top, then bottom, then you got to. No, 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 that doesn't work. Everybody's got their own thing. Everybody's got their own path,
Yeah.
and it really is for us, the medical community, to just be primarily listeners. And when we can intervene, we will intervene.
Mm-hmm. And
Yeah,
educate. So,
yeah,
but and also now, like people have this episode where it's a lot of information. I'm sure. I mean, someone meeting you in person is going to get go a whole lot more in depth. But this is kind of a good, if anything, a Cliff's Notes on
right.
it. So it's amazing. I'm so glad that we were able to get you on here. How can people follow you? Where can people find you?
Love it. Perfect. All roads lead to the website. Please visit our groups page, which you'll find all things gender and non-gender related. If you're having some ringing in the ears, we'd love to see it, but certainly I would love to have a chance to speak with you if there's any gender affirming care needs.
Mm-hmm.
Our website is www.la Los Angeles laent.com.
Oh, that's easy.
That's simple. Yeah, exactly. That one's pretty simple,
Mm-hmm.
straightforward. That will kind of lead you everywhere else.
Mm-hmm.
But we also have www.trachealshave.com,
Mm-hmm.
which I get to show off some of my scarless outcomes. We love that one. I kind of like that one's cool. So that's a website dedicated purely for the scarless approach for the tracheal shave.
Mm-hmm.
And then my Instagram, where I get to show off some of my outcomes. Again, both from we're doing some great things with the robot and for cancer and HPV, but also this predominantly from a gender affirming standpoint because those are the coolest videos.
Mm-hmm.
My Instagram is my first name, Abie underscore Mendelsohn underscore MD. Abie Mendelsohn MD. Check me out. See if you like it.
I just followed you. So,
Yay, thank you.
as you're talking. Awesome.
Yay.
Well, thank you again for joining us. For the listeners, watchers, all that stuff, remember, like, comment, subscribe, follow,
Yes.
rate us, donate to our Patreon, all that wonderful stuff to keep this show going. Dr. Mendelsohn, thank you so much for joining me this week.
Pleasure.
And
Pleasure.
I can't wait for you to see this episode. So,
Me too.
I usually have
Me
them up
too.
early on Friday mornings. So,
Okay.
once
Okay.
again,
I'll wake up early.
you don't have to wake
Let's
up
go.
too early. So, all right, my friend.
Good stuff.
Thank you so much
Okay.
for joining us in
It's been a
Transcending
pleasure.
Humanity. You too.
Thank you.